السلام عليكم. أنا الطالب ركان حداد من كلية الطب في الجامعة الأردنية. Today we're going to be explaining Neoplasia Lecture 2. Let's give a quick and brief explanation of, or revision, I should say, of Neoplasia 1. We just understood what a tumor is. It's a new growth of cells. It can be either benign or malignant. If it's malignant, we're going to call it cancerous. If it's benign, well, we're going to call it benign. A benign tumor is, we said that a benign tumor is called the innocent tumor, and the malignant tumors are really bad. They can cause damage. They can lead to death, cancers. Okay, now we're gonna talk about the tumor growth and invasion. What is tumor growth and invasion? It's basically the process in which the tumors are gonna expand. Okay, expand means they're gonna grow and infiltrate the surrounding tissue. Okay, will have the ability to go to different tissues, potentially spreading to distant sites. Now, let's focus on the expansion and the infiltration of the surrounding tissue. Here we're looking at a primary tumor. This is the tissue around it, and this is the tumor itself, okay? When it starts growing, it's just going to start invading local areas. This is just normal growth of a tumor, okay? This is how a tumor would grow. Around itself, grows bigger. It's going to start taking around from the tissue around it. It's going to start growing على حساب التissue اللي حواليها. Okay? Now, potentially, it has the ability to spread to distant sites. We call that metastasization, only done by malignant tumors. And this spreading to distant sites is a ability of a malignant tumor. Understanding the mechanisms of how a tumor grows and where it invades and if it metastasizes is going to be really important for distinguishing benign tumors and malignant tumors and how we can clinically identify them. Now we're going to learn some specific, some new words. Local invasion. Cancers, they have progressive infiltration. Okay? Malignant tumors have the ability to start infiltrating specific tissues progressively. It's going to start at a specific area. It's going to start spreading more and more and more. And as it does so, it's going to start destroying the tissues around it. So if I'm taking as an example, a tumor, a malignant tumor of an epithelium, okay, call that carcinoma. This is the basement membrane beneath it, and this is the connective tissue. What happens is the tumor starts breaking the basement membrane, spreading to the connective tissue. And now it's going to start metastasizing here, destroying the connective tissue that we have. Okay? So basically, the malignant tumor has the ability to progressively infiltrate, then destroy the connective tissue or destroy the surrounding tissue, whatever it is. Lakin, benign tumors, they grow as cohesive expansile masses. What do we mean by cohesive expansile masses? When they grow as cells sticking together. They're not going to spread anywhere else. They're going to remain localized. So when the growth occurs, the cells are going to start just growing next to each other cohesively, and they're stuck to each other. And the tumor grows really slowly, by the way, okay? In comparison to a malignant tumor, Okay, so this is basically the growth of a benign tumor. It's going to be cohesive and expansile. Expands, and it's cohesive, which means the cells are going to be stuck to each other. Some tumors like basal cell carcinoma, so because I said carcinoma, this is a malignancy, and primary CNS tumors are also malignant tumors. They're locally invasive, but they rarely metastasize. They're locally invasive. They can invade their own tissue. They can invade their own tissue, but they do not metastasize. This is really important to understand that not all malignant tumors can metastasize, okay? Some of them, like the basal cell carcinoma and the primary CNS tumors, they stay where they are. They're locally invasive, but they do not metastasize. So they are not benign, they're actually malignant, even though they do not metastasize, okay? Some features of the benign tumors, they grow slowly and they remain localized, and often will develop a capsule. This capsule is basically compressed fibrous tissue. We'll talk about that later when we study the encapsulation, literally 2 points later. Anyways, so they will have the ability to grow a fibrous tissue layer around them. This is called a capsule. Okay, and this fibrous tissue is just extracellular matrix components. And if we remember from histology what secretes them, we remember fibroblasts. They have the ability to secrete the extracellular matrix proteins and whatever around them. And if we remember what we took in the repair lectures, we understand that fibroblasts have the ability to secrete them when damage occurs. And this is really important to understand. So remember this point for later on. Capsule formation involves stromal cells like the fibroblasts that will respond to hypoxic damage from the tumor compression. Okay, what happens is the tumor starts growing and growing and growing. What is it doing to the tissue around it? Have you ever thought about that? What is it doing to the tissues here that were dependent on specific blood vessels that were in this area? Okay? This tissue here that I just circled is going to start basically dying. Why is it dying? Because something is compressing it. Something is causing hypoxic damage. It's basically taking all the nutrients for itself and disallowing these nutrients from the tissues around it. Okay? This will cause the rise of fibroblasts. They're going to come into the area. They're going to understand that there's something wrong. So the fibroblasts are going to come to the area. These are the fibroblasts. You're going to start secreting extracellular matrix proteins that will end up encapsulating the benign tumor. Okay? So that's it. It's a really easy concept, yani. Okay? This is the fibroblast responding to hypoxic damage from the tumor compression. Malignant tumors, no, they're really aggressive in growth. They have far greater local invasion. Okay? So benign tumors, they remain localized, they remain in their own place. يعني. بينما a malignant tumor is going to have aggressive growth and local invasion. So it's going to start spreading to farther areas in its own tissue. يعني, okay? Metastasis is actually a mark of malignancy. Okay, it's a hallmark of malignancy. تمام? No benign tumors can metastasize. Only malignant tumors can metastasize. They can spread to different tissues. So, to physically discontinuous sites. Okay, what do we mean by physically discontinuous sites? I'm going to go down to a specific picture that I've put for you. This is in our slides. Let's say that this is the primary tumor. Obviously, this is a liver. This is not a normal liver because no liver looks like that. You can identify, even someone that's not studying medicine can identify that there's something wrong in this liver. يعني. So let's say that this is the primary tumor, for example. It's going to spread to discontinuous parts. كيف يعني? This is a tumor, okay? Now it has been discontinued by the normal liver flesh, okay, or the liver tissue. يعني. This is another tumor. That has nothing to do with that. And there is, let's say that there is not a relationship between those, except that this metastasized to that, okay? It just spread into this area, okay? There are no specific connections between them, so we call them physically discontinuous. Yani we know that this is a specific tumor, this is another tumor, this is another tumor, another one, and so on. Okay, so physically discontinuous. This is metastasization. Okay. All right, let's go back to. Okay. So examples like leukemias and lymphomas, they are disseminated diseases at diagnosis. Leukemias and lymphomas, they spread through blood vessels and whatever. Yani. They're considered disseminated, yani they spread really quickly at diagnosis. This means that they're always malignant also. Leukemias and lymphomas are never benign, okay? Because it's spreading throughout your blood, throughout your blood circulation. So anything that's spreading is malignant. That's why we cannot describe them as benign. That's why they do not have a benign feature, مثلا, or they're not benign, then they evolve to the malignant leukemias or lymphomas. They're always host. If someone has leukemia or a lymphoma, he's always, we say that he always has cancer. It's a malignancy. Okay. Tumor encapsulation. We must understand that benign tumors, they are the ones that will sometimes, so often, they will have a well-defined capsule. This capsule has to be fibrous tissue. So capsule, it has to be fibrous tissue that arises from the fibroblasts that secreted the ECM components because of the hypoxic damage that we just explained. Okay? And this capsule will separate it from the surrounding original tissue. So as a result, I'll be able to identify that this is a tumor and this is normal tissue. Okay, I'll be able to remove that benign tumor way easier. So let's look at this picture here. This is a benign tumor, obviously, because there is a capsule part. كل شيء حوالينا. This is the capsule part, and this is the tumor itself inside. Okay, so this tumor was actually encapsulated by this fibrous tissue. And when we want to remove it or excise it, it's going to be really easy because I know the borders of that benign tumor. On the other hand, here I'm looking at what okay. Here I'm looking at a malignant tumor of the breast, okay? So we will not call this a fibroadenoma, maybe a fibrocarcinoma, okay, of the breast, okay? Fibroadenocarcinoma, as we learned last lecture, the namings and whatsoever. Okay, anyways, here I'm looking at the fatty tissue, okay? So all of this is just fatty tissue of the breast. And here, this is a tumor. This is the actual mass that's growing. Now, we must understand that when we look at a malignant, tumor, okay, I think I put the pencil by mistake, so my bad. Let's go back to the laser. Okay. When we look at a malignant tumor, this is the mass, and this is the fatty tissue, let's say F, okay? So supposedly this is supposed to be the normal part, and this is supposed to be the mass part. Like, if you look at it, you would actually not be able to identify anything anymore. All of it can be actually cancer. So it's really difficult to identify the malignancy from the actual real tissue because there's no encapsulation. There's no part that can separate the mass from the actual tissue itself. So they would end up removing the whole thing again because we do not know what healthy tissue is anymore or what malignant tissue is. Okay, so we just end up removing all of it. I think I have a picture of fibroadenoma here as well. Look, this is, if you believe it or not, these are the same things, almost. But this is a benign tumor, this is a malignant tumor, okay? Here we can clearly see that there's a mass that has this brownish color in comparison to this white tissue, okay? So the fibrous tissue here and the adipose tissue here, or the fatty tissue, whatever you want to call it, and this is the benign tumor. We can easily remove it. Okay, let's go back. Okay, now let's start with today's lecture officially. Neoplasia characteristics. Okay, neoplasia is a process of abnormal, uncontrolled cell growth. We already took that, okay? And throughout it, tumors are going to be formed. We're going to classify them as either benign or malignant, depending on characteristics. Either a neoplasia is an abnormal cell growth that is basically called a tumor. And this tumor can either be benign or malignant, and we can identify that depending on specific characteristics. Now, benign neoplasms. Let's talk about neoplasms, whether they're benign or malignant. There's a really important term here. It's called differentiation. What is differentiation? It is the process in which a specific cell is going to change. So this cell, let's not call it specific cell, let's call it maybe a stem cell. I'm not talking about cancers right now, I'm just talking about differentiation in general. So a stem cell or a progenitor cell is going to change or differentiate into a specific cell that has a specific function in the body, okay? So what is the differentiation of tumors, the differentiation of neoplasms? Basically, it's when a tumor takes the function and takes the structure of the tissues around it. If it does, then we call that a differentiated tumor. If it doesn't, we call it a non-differentiated tumor. And there are levels. There are tumors that are well differentiated, tumors that are intermediately differentiated, tumors that are poorly differentiated. So, one of the main features of benign neoplasms is that the tumor is well differentiated. Okay, so it will have high resemblance to the tissue around it. We're going to look at pictures at the end of the lecture. I will show you pictures and I will explain everything that we just talked about. Okay, so they're composed of well-differentiated cells resembling normal tissue. They will exhibit minimal mitotic activity. شو يعني mitotic activity or mitosis? Mitosis is basically the function of the cell to proliferate. So one cell will give me two identical cells. That's proliferation. So a benign neoplasm has actually minimal mitotic activity. That's why its growth is small. Okay? So mitosis here is rare and typically normal in configuration. What do we mean by normal in configuration? That it occurs just like any other cell, the process. There isn't anything wrong in the there's nothing wrong in the separation of a nucleus, separation of the cytoplasm. Everything occurs normally. Mitosis happens like we know it, okay? But it's minimal activity and it's actually rare to occur. Examples like lipomas, we're going to look at pictures at the end of the lecture and explain everything. It's going to be better this way, trust me. Examples include lipomas, which are mature fat cells. So if I ask you if there is a mature fat cell adenoma or a mature fat cell benign tumor, what is that called? It's called a lipoma. Okay, it's called a lipoma. Focus that it's mature fat cells. Okay, and chondromas that are mature cartilage cells. Best when we say chondroma, this is a benign tumor, so mature cartilage cell tumor. Okay, so these are the examples of the benign neoplasms. Capsulations, we understood that there are neoplasms or tumors that are encapsulated by the help of fibroblasts due to the hypoxic damage, like the fibroadenoma. I just showed you a picture of the fibroadenoma. It had that little tumor here and the normal tissue here, and this tumor here had that brownish color to it. That was the capsule, okay? And you understood it occurs due to the hypoxic damage. I will repeat it again. There's this tumor, and this is the tissue. The tumor starts to grow, compressing the tissue around it. So damage is going to occur. Hypoxic damage. ليش hypoxic damage? Because the tumor is going to start using our blood vessels, using everything inside of them, the oxygen, the nutrients to grow. And the connective tissue around it, or whatever tissue around that is actually normal tissue, it's going to lose that. It's going to lose these nutrients, so it's going to start dying. As a result, repair is going to be activated. Fibroblasts are going to be recruited, and these fibroblasts are going to secrete the extracellular matrix proteins, or whatever, to create that capsule layer. Okay. So this is case A. Case B, they're not encapsulated. Okay, but there's a really specific feature here, that they are well demarcated. What do we mean by demarcated? That it has its own borders. We can differentiate it from another tumor. We can differentiate it from the original tissue. Why can we do that? Because, for example, a leiomyoma. Remember, leiomyo is actually, or leiomyo, it's basically the smooth muscle tumors, okay? Leiomyoma is benign. Leiomyocarcinoma is malignant. A leiomyoma in the uterus from the surrounding smooth muscle cells, okay? What happens here is that your own smooth muscle cells, the myometrium of the uterus, مثلا, the myometrium of the uterus is going to create this layer, or it's going to separate this leiomyoma from the original tissue. Okay, it's going to create some sort of separation between the benign tumor and between the uterus. So you will actually be able to demarcate, you will be able to understand that this is the tumor and this is the original tissue. Okay, and this demarcation occurs from the surrounding smooth muscle cells. Okay. The third case, you see, not encapsulated nor discretely demarcated. Here, you cannot actually take it out. It's going to be really difficult to remove that tumor, like a hemangioma, okay? Why? Because you cannot tell what's going on. You cannot tell where it is. You cannot differentiate between it and a healthy tissue, okay? So it's going to be really difficult to be excised. Malignant neoplasms, they have a wide range of differentiation. We said that there are levels of differentiation. They're either going to be well differentiated to poorly differentiated, and there are going to be significant morphologic alterations. Now, a malignancy can exhibit well differentiation, and if a tumor is well differentiated, it's actually considered better than a poorly differentiated tumor or an anaplastic tumor. Okay, having a tumor that is well differentiated, a malignant tumor, أهون بلا, okay, ومن غير شر طبعا from anything. Intermediate differentiation عن الجميع. Intermediate differentiation, the tumor is not really differentiated, but not really poorly differentiated. It's in the middle, okay? Poor differentiation is actually really bad because you cannot originate where the tissue comes from, where the malignancy comes from. So, for example, if there is a malignancy in the liver, we do not know that yet. We took the tumor out, okay, or we took a specific tissue out, okay, and we examined it under the microscope, and we look at it. It's a malignancy, but we do not know what tissue it comes from. We're going to look at pictures later. I promise you this is better. Okay, we're going to look at the tissue, and we're not going to understand anything. Where does this come from? from what tissue did I take this biopsy from? Because nothing is obvious for me, okay? This tumor does not make sense, okay, when it's poorly differentiated. In cases like that, we use immunohistochemistry staining. Basically, we would target specific proteins and enzymes in a specific tissue. So we would say like, oh, let's consider this from the liver. So it has to bind to so it has to have specific proteins and enzymes. So I will target it by immunohistochemistry. So it will bind to specific proteins or enzymes that are supposed to be there. And if it binds, this means that it's a biopsy from the liver. If it doesn't bind, then it's from another tissue. Okay, really simple. Anaplasia is actually the loss of structural function, from the structural and functional differentiation. You lose everything about the cell. Everything is lost. You do not know what its function is, nor what its structure is, so it's kind of similar to poorly differentiated, but it's still worse, okay? Because here, not just you do not differentiate, you do not have a function here, you just lose everything, okay? So poor differentiation means it tried to differentiate, okay? It tried to do something with itself, but it couldn't, okay? This is poor differentiation. It tried to do something with itself, but it couldn't. بينما anaplasia here, you lose everything. The structure is lost. The function is lost, okay? Malignant tumors lack well-defined capsules. Microscopic examinations, they reveal tiny crab-like feet penetrating the margin and infiltrating adjacent structure. Malignant tumors are difficult to be removed totally. So we would notice that malignant tumors have these crab-like feet around them. So this is a tumor and they have this really small crab-like feet around them, okay? So again, tumors are either well differentiated, they resemble the tissue they come from or they rose from مثلا. Intermediate differentiation بالوسط. Poor differentiation, you cannot identify what the tissue is unless you use immunohistochemistry or something. Anaplasia, you lose everything. You lose the structure and you lose the function. So instead of being poorly differentiated, you try to, but it didn't work. No, you do de-differentiation, okay? If you see تراجع حتى, you lose everything. Okay, here are other characteristics that we need to understand. Nuclear pleomorphism. Pleomorphism, morphism basically is the shape and whatever. So basically nuclear pleomorphism, the size and shape variation. Nuclear abnormalities, we would start seeing extreme hyperchromatism. Why would we notice that? What do we mean by hyperchromatism? Basically, the nucleus is going to be darkly colored. لسه بتكون أغمق لما نطلع عليها بالميكروسكوب. Okay, so extreme hyperchromatism. It occurs due to new genetic material that has been formed, specific condensation of the DNA. Okay, برضه حصير nuclear size and shape variation, unusually prominent single or multiple nucleoli. This is nucleoli, not nuclear. Okay, nucleoli. Increased nuclear to cytoplasmic ratio. Usually it's 1:4 or 1:6. It's going to become 3:1. Okay, 3:1, which means that the nucleus is going to expand really largely. Okay, it's going to become really large. The nucleoli are going to get enlarged as well. That's why they're going to be prominent. Okay, we just said they're going to be unusually prominent because they enlarged themselves. Increased mitotic activity. So here mitosis is really high. It's not rare زي ما كنا نحكي بالbenign. Atypical mitosis. Atypical it's not typical. A مع أي كلمة بتعكسها. So typical إشي طبيعي. Atypical مش طبيعي. Tripolar or quadripolar. هاي لازم space مش V. مش مشكلة بنعدلها. So tripolar or quadripolar. What do we mean by that? When the nucleus tends to divide, عادة كل nucleus تروح على جهة. Okay? So this is the whole cell around and this is the nucleus. تعمل division. Okay? So هاي تفصل عن هاي. That's it. When we say tripolar, this means that it basically cut itself into 3 parts. So we would notice this shape under the microscope. This basically resembles the lambda sign. So people call this lambda or the tripolar mitosis. Okay, it's abnormal or atypical. Tumor giant cells. We notice really massive cells present. We're going to look at pictures, so don't worry. Loss of polarity of tumor cells. We know that some cells they have polarity like epithelial cells. بتلاقي you'll find the nucleus مثلا near the basolateral membrane with specific proteins, and you would find other different proteins near the surface of the cell. خلاص near the surface of the cell, near the apical surface of the cell. Okay, tumor cells are going to lose their polarity, but they're going to lose their functional capacity. Sometimes they can lose their functional capacity. We call that the paraneoplastic syndrome. So a tissue had a specific ability or a specific functional capacity. When it loses it, we call this the paraneoplastic syndrome. Again, differentiation. It refers to how much neoplasms resemble their parenchymal cells of origin, both morphologically and functionally. يعني, it basically shows me, the differentiation, how similar a tumor is to its surrounding tissue that it had rise from, okay, or it had rose from, whatever, it doesn't matter. Okay, it basically tell me how similar it is to the surrounding tissue it got created from. Okay, both morphologically and functionally. So benign tumors, they exhibit well differentiation. Malignant tumors, they have a variety of differentiations. Anaplasia, there is a lack of differentiation, so you lose everything. Okay, and anaplastic tumors are going to be more aggressive and less predictable. We will not know what they're going to do because we do not know where they originate from, what they do, whatever. Now let's talk about dysplasia and carcinoma, two terms that are really important. Okay, dysplasia, it refers to abnormal change in the size, shape, and organization of cells within a tissue. What does that mean? The cells are going to start losing themselves. Okay, cells are going to start losing themselves. لكن when these changes are severe and affect the entire thickness of the epithelium, we call it a carcinoma in situ. Okay, let's draw and understand what's going on. I'm gonna actually, let's look at a picture here, يعني, because it's better than drawing, I guess. Do I have a picture for that? I think I do. Okay, I do. Okay, let's look here at at this epithelium tissue, let's say of the skin. Here's the keratin layer. This is a cancerous tissue, okay? Oh, and there's a carcinoma in situ because it affected the whole tissue. We'll talk about that now, يعني. But let's imagine a healthy skin tissue, for example. We'd have that keratin layer here. We'd have the basically cells that are done with proliferating and are starting to die here. And here we would have the organized layer of cells. Okay, they have to be organized all next to each other and whatnot. They're going to be highly mitotic. They're going to keep on proliferating. Okay, we took that in histology. Okay, so if dysplasia occurs to this part only, ايش يعني this part only? يعني you're losing the organization. That's it. يعني بلشت cells بعد عن بعض. The cells starting getting away from each other. Okay, هيك here we're talking about dysplasia. طيب, what if it affected this area as well? So here we're noticing mitotic activities as well, abnormal mitotic activities, more cells, إلى آخره, برضه dysplasia. لكن if it affected the whole length of the epithelium, هو اللي بنحكي عنها a carcinoma in situ. So this is really simple, يعني مش هالمصطلح الخرافي. Okay, موضوع جدا سهل. Okay, so carcinoma in situ representing a pre-invasive stage of cancer. Now, carcinoma in situ is basically a stage of a tumor that stays in its place and it still did not invade anything, did not metastasize. So can we consider it a benign tumor, carcinoma in situ? Of course not. Okay, carcinoma in situ is a malignant tumor. Okay, whether you like it or not, it did not metastasize yet. It's a malignant tumor. It's a pre-invasive stage of cancer. What about dysplasia? Dysplasia can be benign, can be malignant. Okay, dysplasia لما تتحول لcarcinoma in situ, obviously it's malignant. Dysplasia usually rises because of factors affecting a specific tissue. Okay, something is affecting a specific tissue, so it starts changing itself. Okay, if you remove that affecting factor, the tissue has the ability to go back to its original state. Okay, this is definitely reversible. So it's not even considered a tumor in this case. It just it goes back to its original state. Okay. In general, we must understand that this plastic epithelium, يعني, it's not actually cancer. It depends on the it depends on the level of it. Is it mild, moderate, or severe? Okay. So loss of uniformity, not synonymous with cancer. It can be mild, moderate, or severe. Mild and moderate dysplasias, they have the ability to regress. يعني, they go back to their original state. يعني, the tissue goes back to the healthy state. لكن if it reaches a severe dysplasia, it can become carcinoma in situ, which is malignant. Okay, so it's a severe form of dysplasia, and the full thickness of the epithelium is involved. Okay, this is considered the pre-invasive stage of cancer, indicating potential progression to invasive carcinoma if not treated. So if you not treat the carcinoma in situ, it's going to invade, it's going to metastasize, and so on. Pre-invasive stage is basically like the carcinoma in situ. They did not yet invade the surrounding tissue, but they will eventually if not treated. Early detection and intervention will prevent progression to invasive cancer. So it's really important to prevent that before it happens. Okay? طيب. كمل الآن. Metastasis. Okay? What do we mean by metastasis? It is the process in which cancer cells, they will spread from the primary tumor to distant sites in the body. This is a hallmark of a malignant tumor. Okay, so metastasis, the cancer cells, they have the ability to spread from the original site, and they start going to different sites of the body, different sites of the same tissue itself that are discontinuous with the primary tumor. Okay, really important to understand that this is only for malignant tumors. It can occur through various pathways. We're going to study those, like the lymphatic pathway, hematogenous spread, and this is a key factor in cancer progression and treatment challenges. Some statistics that 30% of patients with newly diagnosed solid tumors, excluding the skin cancers other than melanomas, يعني like the basal cell carcinoma or the squamous cell carcinoma, okay, present with clinically evident metastasis. يعني 30% اللي عندهم solid tumors, newly diagnosed solid tumors, they have metastasized. 20% they have occult or hidden metastasis at the time of diagnosis. Yani I can diagnose that the person has cancer. 20% of the times the cancer had already metastasized and I couldn't find it. Okay, and we'll talk about that later. Yani. Metastatic spread or metastatic spread. Okay, the definition is the dissemination of tumor cells to physically discontinuous sites. Yani they're going to start moving to sites other than the primary tumor area. Okay. What is the significance here? It basically indicates malignancy. Okay? Basically, benign tumors do not have the ability to metastasize. Okay? So the metastatic spread is basically a feature of malignant tumors that are going to be disseminated to physically discontinuous sites of the primary tumor. There are specific factors influencing that spread. When there is a large tumor, and anaplastic tumors, so larger ones and more anaplastic tumors are more likely to metastasize, although there are exceptions, minimal exceptions. Some extremely small cancers have been known to metastasize, while some large and ominous-looking lesions may not. Okay, so the general rule is that the larger it is and the more anaplastic, the easier it would metastasize. Lakin, there are exceptions that are extremely small, that there are extremely small cancers that can metastasize, and large ones that cannot. Okay? طيب. First method of metastatic spread اللي هي seeding. شو يعني seeding? Let's imagine an area of soil. This is soil, تراب. Okay? I put specific seeds in them. I threw them in different places. Okay? And these seeds are going to start growing. Okay? This is literally what seeding of cancer is. There is a specific cavity that the tumor will implant itself in, and it will start growing and spreading to even other different sites. Okay? So what is seeding? It occurs within body cavities. زي الحفرة اللي فتحتها عشان تحط البذرة فيها اللي بدك تزرع النبتة اللي بدك تزرعها or whatever. Okay? Where tumor cells can implant themselves and grow. Common in certain cancers that invade adjacent structure or body spaces, like in the ovaries مثلا. The ovaries can have seeding. We will notice some small tumor structures on the ovaries. Okay, this is called seeding of the ovaries. Okay, now lymphatic spread. There are more information down when we talk about the pathway and everything. Okay, now lymphatic spread is actually more typical for carcinoma. Okay, let's focus on a specific thing. There is lymphatic spread and there is hematogenous spread. هذول التنتين ناس بتخربطوا فيهم. ليه؟ A lymphatic spread is more typical for a carcinoma. Does that mean it does not or doesn't have any sarcomas spreading throughout it? No, there are sarcomas spreading throughout it. Lakin, the preferred the preferred type of cancer for the lymphatic spread is carcinoma. Okay? But what about the hematogenous spread? It's favored by the sarcomas. Does that mean that carcinomas cannot spread through hematogenous pathway? No, they can also spread through the hematogenous pathway. Lakin, carcinomas are favored by the lymphatic spread. Sarcomas are favored by the hematogenous spread. Okay? So, carcinoma, they arise from the epithelial cells. Involves the movement of cancer cells through the lymphatic channels to regional lymph nodes. Okay? I put a picture here that I'll be explaining in a second. I added that recently. Yani. We're going to be explaining مثلا if a tumor arises in the breast area of a female مثلا like breast cancer. Usually it will metastasize to the axillary lymph nodes, okay? So they will metastasize to the axillary lymph nodes, and we'll be able to identify that in a second. I'll come back to that after we're done, okay? So, نكمل lymphatic spread, and they're gonna spread through lymphatic channels to regional lymph nodes. Pattern of involvement depends on the primary tumor's location and local lymphatic drainage pathways. Okay, how can I understand what lymph node is involved? By basically knowing where the primary tumor is. If the primary tumor is near the breast area, I will instantly understand that the first lymph node that's going to be affected is the axillary lymph node. We will also call that a sentinel lymph node. Okay, we'll talk about that in a second. Sometimes skip metastasis can occur. The cancer cells are going to bypass the intermediate lymph nodes. Usually, when we want to examine the breast cancer, we would understand that the lymph nodes have to be swollen, if it's malignant, okay, any breast cancer. We would have to examine the axillary lymph nodes. What if skip metastasis occurs? Basically, the cancer is going to flow from the lymphatic channels, and they're going to go to different lymph nodes. This is called skip metastasis. They skipped what they usually, or where they usually should be. So this can cause to misdiagnosis or whatever, okay? So skip metastasis is actually something really dangerous, and the cancer cells are going to bypass the intermediate lymph nodes. They're going to go to different ones. Okay, hematogenous spread. It's favored by sarcomas. So the cancers here arise from connective tissues, okay? Sarcoma and connective tissue, or اللي حكينا عنها mesenchymal tissues. Cancer cells enter the bloodstream and travel to distant organs. Hematogenous spread, من the bloodstream. That's it, hematogenous, bloodstream. So they will travel to distant organs like the liver, like the lung, okay? So this pathway actually causes metastasis in the liver and the lungs, okay? They are the most common secondary sites of spread from the hematogenous spread, okay? طبعا if there is if there is a hematogenous spread from the portal circulation أكيد الليفر هو اللي راح يتأثر okay لكن إذا systemic or خلينا نحكي caval vena caval or whatever caval circulation اللungs هم اللي راح يتأثروا. So just understand لما نحكي liver في portal circulation, lung they have caval circulation, okay? كل واحد له circulation خاص فيها. برضو عندك البونز. Sentinel lymph nodes هم the first lymph nodes that the cancer cells are going to spread to from the primary tumor. زي ما حكينا, a breast mass, okay, a breast tumor, it's going to metastasize first to the axillary nodes. بس هذا السالفة كلها. Okay, so we can call the axillary lymph nodes in this case a sentinel lymph node. شوف قديش الموضوع بسيط. I just look, where did the cancer start? Wallah, in the breast. Okay, where did it go to first? To the axillary lymph nodes. I call the axillary lymph nodes the sentinel lymph nodes. So it's really important in staging cancer and determining the extent of the disease spread. If there is low metastasization to that area, then it's still early, not really, in the early stages, and so on. Sentinel lymph node biopsy is a common procedure to assess metastatic spread, okay? We can also inject blue dye or some radioactive material in the primary tumor, and we would basically watch how that dye spreads to a specific lymph node that it spreads to, by metastasization, okay? The level of dye that reaches and so on, it actually just tells me how, first of all, it tells me the node that's going to be affected and tells me how much metastasization is occurring. Pathways of metastasis, okay? We know that metastasis is a process in which cancer cells spread from the primary tumor area to distant sites. So نعيدها مليون مرة. There's a specific area, بتبلش الtumor to spread to different areas, okay? Different areas. The main pathways حكينا seeding, lymphatic spread, hematogenous spread, كل واحدة لها mechanism. Seeding involves implantation into a cavity, occurs in the abdominal and the thoracic cavities. طبعا جهزت لكم جدول حاط فيها كل الاكزامبلز للباثويز of metastasis. اوكي هذا شيء حلو يعني. هذا الجدول بمساعدة تشات جي بي تي رسميا يعني. اوكي كمل. Pathways. Seeding commonly occurs in the abdominal and thoracic cavities. Lymphatic في شيء جديد يعني حكينا we basically explained both of them. Lymphatic spread حكينا it's more typical for carcinoma لكن all cancers can use this route. صح حكينا carcinoma ولا sarcoma ولا أبصر شو they can use the lymphatic pathway. لكن مين what is more يعني خلينا نحكي what is the most typical thing to travel or to go through the lymphatic pathway هي الكارسينوما. Cancer cells they travel through lymphatic channels to regional lymph nodes يعني بينتقلوا من lymphatic channels لأقرب lymph node موجودة okay إشي بالريجن حواليهم. So cancer cells they travel through the lymphatic channels to regional lymph nodes. Pattern of lymph node involvement يعني the type of lymph node that is involved depends on the site of the primary tumor and the local lymphatic drainage. And as we said again, if there is a breast mass, a malignancy in the breast, okay, we will first expect the axillary nodes to be affected. So depending on the primary tumor's location and the lymphatic drainage around it, we would understand which lymph node is going to be affected first, okay? Also, we talked about skip metastasis. It's going to bypass the intermediate lymph nodes. It's going to go to other things. And through the lymphatic pathway and from skip metastasis, eventually it can reach the vascular system via the thoracic duct. يعني the cancers are going to keep going around, skipping everything until they reach the thoracic duct. They're going to enter and they're going to start reaching the vascular system. Okay. Hematogenous pathways. Hematogenous pathways, it's a favorite pathways for sarcomas. Again, it's also utilized by carcinoma. لكن حكينا carcinoma أهم شيء لها lymphatic pathway. Sarcoma أهم شيء لها hematogenous pathway. Blood-borne cancer cells, they follow venous flow draining to the tumor site. Okay? What do I mean by the blood-borne cancer cells and whatsoever? Sometimes the veins can get affected. Okay? Sometimes the veins can get affected. What does that mean? The cancer is going to start metastasizing through the veins. Okay? So بكل بساطة a blood-borne cancer cells هم عبارة عن hematogenous spread or hematogenous pathway throughout what? Throughout the veins. That's it. Okay? So the spread can occur throughout the veins. The hematogenous spread can occur throughout the veins. The arteries are less penetratable than veins. So venous invasions are going to be more common. Okay? So if a venous invasion occurs, this is going to cause a hematogenous spread that follows a venous flow, okay? That follows a venous flow. Liver and lungs are the most frequent secondary sites for hematogenous spreads, and specific cancers have predelications for certain organs, like prostatic carcinoma to bone, bronchogenic carcinoma to adrenal glands, vertebral carcinomas. So let's imagine that this is the vertebra, okay? There are paravertebral plexus and some sort of veins, arteries, whatever. They will the cancer is going to metastasize to them, and from them they're going to move to parts. If it's in the cervical region, it's going to move to the thyroid. Okay, if it's in general the vertebral region from below, the sacral region, whatever, lumbar region, it's going to reach the prostate. Okay, so if you look here مثلا at this image that I added just recently, here I'm looking at the thyroid. Okay, the thyroid has some, obviously has some these blood vessels, whatever, that's coming from the paravertebral plexus that has been infected from the vertebral carcinoma. Okay, so it will spread to the thyroid. So if there is a vertebral carcinoma, it will spread to the thyroid, spread to the prostate. Okay, really simple مش الموضوع الخرافي. Okay. You can read this we already talked about that before. Okay, we basically mentioned everything okay. Certain carcinomas have a propensity to grow within veins. Okay, some carcinomas can grow in veins. Renal cell carcinoma often invades the renal vein to grow in a snake-like fashion up the inferior vena cava, reaching the right side of the heart. We know that the heart has a superior vena cava, inferior vena cava. Inferior vena cava basically takes the blood, the bad blood, let's call it, okay, that comes from the lower part of our body, okay. It takes it through the inferior vena cava, okay. طيب. Renal cell carcinoma, the kidneys have a renal vein, okay. The renal cell carcinoma can invade that vein. If it invades that vein, we know that the renal vein is going to end up going through the inferior vena cava, reaching the heart. Okay? So basically, it would end up with the carcinoma invading the renal vein and it will grow up the inferior vena cava, reaching the heart. Hepatocellular carcinomas, they will penetrate and grow within the radiuses of portal and hepatic veins, reaching the main venous channels. Okay? Obviously, a carcinoma in the liver, okay, it's going to penetrate the portal and hepatic veins, منطقي, because they're around it, okay, they are around it, so it's going to spread to it, it's going to metastasize to it, okay. As a result, it will reach main venous channels. The anatomic localization of a neoplasm in its venous drainage cannot explain the systemic distribution of metastasis. So we basically here, it's just telling me that you cannot actually predict the pathway of metastasis all the time. It can be different, okay? مثلا, prostatic carcinoma preferentially spreads to bone, okay? So if there's a prostatic carcinoma, I would tend to check the bone, مثلا. Bronchogenic carcinoma, it tends to involve the adrenal glands. فبس إنه the anatomic localization, والله إنه I'm talking about مثلا the let's say the prostatic carcinoma has nothing to do with our femur مثلا or our humerus or whatever يعني, okay? So preferentially it spreads to bone, although there is no anatomic localization يعني. فاهم كيف؟ Okay. Neuroblastoma spreads to the liver and bones. Skeletal muscles, although rich in capillaries, are rare sites of tumor metastasis. هي والheart, okay? They are rare sites of metastasis. Here is just the pathways here, just يعني read them very quick. We already talked about the description here. Just some examples, just read them real quick. Now let's look at the pictures. This is a lipoma, okay? A lipoma is a benign tumor. A benign tumor is well differentiated. فإذا أنا بدي أجي أطلع عليها, this is the lipoma. رحنا عملنا zoom in على picture. So here I'm looking at mature adipose tissue, which is a lipoma. تطلع عليها, it literally looks like normal adipocytes. Like I'm just looking at maybe white adipose tissue or whatever. يعني I'm just looking at specific adipose tissue. You tell here that this is a lipoma. It's a benign tumor because it's well differentiated. Okay. The structure واضح, as we can see it's capsulated. طلع كيف مبين انه في اشي بيختلف عن اللي حواليه. Okay, this is a lipoma. Here I'm looking at anaplasia. ايش يعني anaplasia حكينا؟ مش بس poor differentiation, it's a lack of differentiation. كل شيء ضرب. Okay. بطلع هون في عندك a tumor giant cell. هون في خلية كتير كبيرة. طلع. By the way, can you determine what tissue this is? If I give you 500 hours, you would not be able to identify what tissue this is, because normally we do not have any tissues that look like that. Okay, so this just determines that here this is an anaplastic tissue. It lost everything, the structure, the function. I cannot determine what it's from. I can see multiple nuclei here. I can see a prominent nuclei as well. Nuclei جدا كبار هون. Okay, look at this method. Look at this cell. Look how big the nuclei is. Okay, look how big the nuclei is here as well. يعني in general, we're just looking at a cell that lost everything about itself. There's nothing obvious here, okay? So anaplastic tissue, يعني بس you just have to determine that شو اسمه مثلا multiple nuclei, loss of function, loss of structure, that's it. This is a well-differentiated squamous cell carcinoma. Here I'm looking at squamous cells. Okay, the picture can be more يعني واضحة أكتر صراحة. مش كتير مبين إنه مبين إنه squamous cells, but not really in a good way يعني. Anyways, if you look inside here, this is a blob of keratin. Okay, it's an eosinophilic blob. يعني whenever we want to check for a well-differentiated squamous cell carcinoma, we must understand carcinomas have the ability to secrete keratin. Okay, so I would determine if it's a well-differentiated squamous cell carcinoma by the presence of keratin. Okay, so موجود squamous cells, they're differentiated into the squamous cells يعني فيش اشي مضروب خلينا نحكي كتير بالتشيو، لكن there are blobs of eosinophilic sites هدول هم ايش؟ هدول هم الكيراتين that are secreted by the squamous cell carcinoma. Okay? طيب. Okay, look at the picture here. This is abnormal mitosis. Why? I literally drew the picture why it's called abnormal mitosis in قبل شوي. حكينا شيء اسمه tripolar or quadripolar اللي هي abnormal mitosis. طبعا here obviously في عندك tripolar mitosis طلع كيف؟ عملت لك lambda sign, okay? Either lambda or tripolar. Okay? Here I'm looking at a carcinoma in situ. الفكرة هي إنه it started as dysplasia يعني بلش basically the structure started to get ruined at the basal area. بعدين the structure started to get ruined here. Then the structure got ruined at the keratin area. So all the epithelium got ruined. Okay, all the epithelium got dysplastic. It's severe dysplasia. You can call that a carcinoma in situ. Okay, especially look at these weird blobs. Look at the loss of organization here. How the cells don't want to stay in their places. They started moving upwards. The keratin layer مش مظبوطة. يعني we can tell obviously that this is a carcinoma in situ. Okay. Fibroadenoma of the breast. We talked about that. Also, this is a cancerous of fibroadenocarcinoma of the breast. Okay. This is a liver with metastatic cancer يعني because it's spread to different parts. يعني ما بدهاش اثنين يحكوا فيها كتير واضحة. Okay. What type of cells make up a lipoma? خلينا نحل أسئلة يعني مراجعة سريعة. What type of cells make up a lipoma? أكيد هم mature fat cells. D. What does differentiation refer to in the context of neoplasm? شو يعني differentiation? Is it the ability of tumors to grow? لا ما لهاش دخل. The classification depending on size? لا. The process by which tumors spread? لا. The extent to which neoplasms resemble their parenchymal cells of origin. Okay? What distinguishes a carcinoma in situ from other forms of dysplasia? بدك تفهم إنه carcinoma in situ involves the entire thickness of the epithelium. Okay? How do benign neoplasms differ from malignant neoplasms in terms of cell differentiation? شو الفرق بين البناين neoplasm والmalignant? البناين والmalignant, okay? البناين neoplasms, we must understand they are well differentiated, لكن المalignant they vary. So C. What type of cancer typically spreads through lymphatic channels? Okay, حكينا lymphatic channels they basically depend on أو خلينا نحكي they favor carcinomas. Okay, which cancers have a tendency to grow within veins? Okay, نحكي الآن إحنا عن within veins. We talked about the renal cell carcinoma and the hepatocellular carcinoma. طبعا بآخر شرحته بالصورة اللي كنت حاطط لكم إياها. What role do the liver and lungs play in hematogenous spread of the cancer? We must understand that they're a common site for metastatic deposits. Okay, that's it. طيب. What is dysplasia and how is it recognized histologically? Dysplasia هي عبارة عن is a loss of cell uniformity and architectural orientation. Okay, بدهاش شيء. طبعا حكينا it is not synonymous with cancer. ما جبنا سيرة necrosis ولا inflammation. It's not always a benign condition يعني obviously it requires monitoring. هاي غلط. Okay, فالجواب هو D. What is a common secondary organ for metastatic deposits from organs with portal venous drainage? أكيد الليفر مباشرة. سمعت أنت portal وعلى الليفر. What is meant by seeding? And the tumor cells are gonna basically implant themselves in cavities. Okay, so the spread of neoplasms within body cavities. See, how does prostatic carcinoma preferentially spread in the body? نعرف إنه prostatic carcinoma spreads to the bone. هذا هو preference تاعها. Okay, spreads to the bone. This is the lymphatic system. حكينا if there is a, let's imagine this is a female, if there is a breast tumor, okay, the breast tumor is gonna metastasize if it's malignant to the lymphatic vessels around it, to the lymphatic channels, around it, which will empty up in the lymph nodes, and I'll be able to identify the metastasis by the growth of the lymph nodes. يعني they're going to grow bigger, they're going to be really easy to identify, and so on to every other part. Okay. Here, when we talked about the kidneys, then the renal cell carcinoma that spreads into the renal vein and goes into the inferior vena cava. Okay. Here the thyroid picture طبعا obviously these pictures هدول طلعت they're not required by you, they're just for extra understanding. وشكرا لاستماعكم، أتمنى أنه عجبتكم المحاضرة. وإن شاء الله lecture 3 بتنزل بكرة، Neoplasia Lecture 3 بتنزل بكرة يعني. Yeah, that was it for today. I hope you enjoyed it and I hope you understood everything about Neoplasia Lecture 2. Good luck.